NHS staff are protesting against the government's decision not to give a recommended 1% pay rise to all NHS employees.
Well, 7 unions are taking part in the strike, including the Royal College of Midwives, who are walking out for the first time in their history.
Unions taking part have more than 400,000 members across England out of a total of 1.3 million NHS staff.
The strike will be followed by 4 days of working to rule, starting tomorrow.
Well, Dave Prentice is the...
Well, this is the last resort for us. But in the health service, we have a pay review body. It sets the rates of pay. The government put in their submission. The trade unions submit their evidence, and they decide the increase for health workers. This year, they decided with the government to implement a pay policy figure of 1%. Goes back to the Department of Health, goes back to the government ministers. They decide to renege on that agreement. And they say that only those at the very top of the grade can get 1%. It's not consolidated, can't be used for overtime, can't be used for pensions. And anybody working through the grades, maybe because of equal pay, working towards the top of the grade, they get no increase. They've reneged on a system of determining health service pay, which has meant that there has been no industrial action in the health service over pay for over 32 years. And we tried talking to the ministers, we tried talking to the department. Nobody will talk to us, nobody will listen, and as a last resort, we brought our members out on strike for 4 hours just to show the strength of feeling, just to show the people of this country what is happening to the people who look after us, who provide for us in our hour of need, who make sure that our health service runs, and the way in which they are now being treated.
Well, I had a meeting with Dave Prentice, and I've said consistently that we will talk to them if they're prepared to look at reforming the system of increments, which is incredibly complex and unfair. But the bottom line here is very simple. I've had clear advice, analysis that says that if I accepted the pay review body recommendations, NHS managers in hospitals would lay off around 4,000 nurses next year and around 10,000 nurses the year after. And the NHS has just come through a very difficult period with the tragedy of mid-staffs. And responding to that magnificently, we have now got 5,000 more nurses on our hospital wards in just 1 year. So hospitals are recruiting nurses like crazy at the moment. And this would put that into reverse, and I don't think that would be the right thing for patients.
During the month, I have to budget constantly throughout the month just to make it to the end of the month. Just to buy, it's a choice. You pay your bills or you buy food. That is the choice I have each and every month. I haven't been abroad for years. I can't afford that luxury, and it is a luxury now to have a holiday.
And you work hard, you do the kind of work that a lot of people, frankly, wouldn't really want to do.
Absolutely.
But do you see that amongst your colleagues at the hospital in Kent, that this is something that all of you are in the same boat?
I work with dedicated staff that now the government is abusing our good nature because the government know we're going to carry on caring for these vulnerable people in their hour of need. And today I'm here to show I've got a voice, and I actually think I am worth a 1% pay rise.
You're telling me that you don't often come on these kind of marches. This is something quite new for you. Why have you decided to get involved now?
Because this is my second march, and to me, we need a voice. We need to be heard. The government needs to listen to us. We're asking for a 1% pay rise. We're worth it.
That decision that you have in the latter part of the month, every month, about how to eat, how does that feel to you as someone who's worked for decades? And you're still at that position where you have to make really hard decisions about what you eat at the end of the month.
It's demeaning. It really is. You go to the supermarket and you can't just put things in the basket, what you want to buy. You've got to look at the price first. I've worked for the NHS in different areas of the NHS for nearly 30 years. I'm still in the same position. I am 20% worse off now than what I was 10 years ago, 5 years ago even. while the government, they've just accepted 11% pay rise. Money after 1%.
But when it comes to our elderly, there's perhaps one thing that matters above everything, and that is knowing the NHS is there for you. Now, from Labour last week, we heard the same old rubbish about the Conservatives and the NHS. They were spreading complete and utter lies. And I just think, how dare you? It was the Labour Party who gave us the scandal at mid-staffs. Elderly people begging for water and dying of neglect. And for me, this is personal. I'm someone who has relied on the NHS and whose family knows more than most just how important it is. Who knows what it's like when you go to hospital night after night with a sick child in your arms, knowing that when you get there, there were people who will love that child and care for that child just as like it was their own. And how dare they suggest I would ever put that at risk for other people's children? How dare they frighten those who rely on a national health service?